I keep it on?
Yeah, you don't have to push your finger on it.
Oh, okay, okay. All right, yeah, okay. I think we are ready to start. Good morning, everyone. Welcome to the Assistive Technology session, focusing on Africa and Asia. I'm very, very excited to be on this panel with some brilliant minds and some brilliant ideas, because I believe there's something for each one of us to learn from some of these projects. And these are some of the projects that are really transforming lives across the continents. So I hope you'll get a chance to also ask questions and give some input about what you hear today. So a growing number of assistive technologies originate in Africa and Asia. And in this session, some of the representatives are actually Project Awardees. So some of the things I want us to remember today is the importance of assistive technology when it comes to persons with disabilities. And 1 in 10 people that need only 1 in 10 people that need assistive technologies actually have access. So we still have a lot of work to do. The beauty of it is that the Global North has invested a lot in both research and development for quite a long time. And the Global South is just waking up to this new innovation. And the beauty of it is that how I look at assistive technology is that we do not always have to rebuild everything from scratch. We don't have to reinvent the wheel. Some existing assistive technologies in the market are ready and available, and they are open source, they are free for people to use. And then, of course, some assistive technologies are very, very pricey. And unfortunately, some of those, even though they can really transform lives, they might not work for, let's say, the African market, or some of the Asian countries may not be able to afford. So one of the key considerations we should always have when we are thinking of a market like Africa and Asia is cost. We have to make sure that our solutions are affordable to some of these markets. But at the same time, we have young people who are very innovative and ambitious and have great ideas. So I hope that we can continue to support in terms of providing expertise to their great ideas so that they can innovate around their communities. At the same time, we can also provide funding. I always say, being an African, if we are developing assistive technology products for Africa and Africans have come up with the solutions, I'll tell you for sure they need expertise to support the ideas they have. But at the same time, they need funding. If we don't provide funding, it just remains an idea. So I hope that we can see the work that has been done today, and we get to learn something from it, and we see where we go from here. And I want to take this time to thank the Zero Project for giving us a platform to showcase what we are developing in our own countries. And I hope that we can learn something from each other. So we will start we'll receive a report from the World Health Organization about assistive technology. They've done some research and they have some good findings that they're going to share with us. After that, we will travel to Kenya, and our presenter is actually online. She's still back in Kenya, so it will be a virtual presentation. Then we'll travel to Malaysia, and our presenter from Malaysia is here, and we will learn about a return to work program that has been very successful. Then we will go to India on a pediatrics assistive technology innovation. That's very, very exciting. Then we'll travel back to Kenya and meet Bernard CHIIRA, and Bernard will share with us about GDI Hub and Innovate Now, some of the work that they're doing in Africa. And finally, we will have Bright, and Bright is actually a winner of the Inclusive Africa Conference Innovation, and he will share some of the work that he's doing in his country. And last but not least, and I'm sorry for forgetting this one, we will travel to Djibouti to learn about some smart cards that are helping persons with disabilities. So I want to welcome everyone, and I will start off with the World Health Organization report. Over to you, Wei.
Thank you very much, Irene, for the introduction. My name is Wei ZHANG. I'm the technical officer working in the Access to Assistive Technology program in the World Health Organization headquarters based in Geneva, Switzerland. My presentation is to really warm up the discussion today, and I will give a brief presentation about the key findings and the recommendations from the first ever global report on assistive technology, which was jointly published by WHO and UNICEF in May 2022. So, per WHO's definition, assistive technology is an umbrella term of assistive product and related services. So in this slide, there are 15 pictures showing just some examples of assistive product. There is a wide range of products that support and maintain functions and improve health and well-being. As you can see from this picture, assistive product can be a pair of simple reading glasses. It can be pill organizer, crutches, shower chairs, hearing aids. It can also be sophisticated robotics or software to support time management. And the typical users of assistive technology are people with disabilities, older people, or people living with chronic conditions. To understand the global situation on assistive technology, WHO launched an initiative to measure the access to assistive technology in the population. In this slide, it shows 35 countries' names highlighted in a simplified world map. And those are the countries where this data collection had taken place since 2019. And by the end of December 2021, more than 300,000 individuals had been interviewed across those 35 countries. And in the next few slides, I will present the key findings from this global multi-country household survey. First, let's look at the need. I think some of the numbers Irene just introduced might be refreshed by this newly published global report. Based on the national and subnational population survey from those 30-some countries, we found out globally 2.5 billion people need at least one assistive product. And this figure will continue grow to over 3.5 billion by 2050. Spectacles are the most commonly needed assistive product. This is probably not a big surprise. Just look at it in this room, how many of us are wearing glasses to support our daily function. And if we exclude this single most needed assistive product, still 900 million people globally need assistive product, and this number will grow to 1.3 billion by 2050. And on the right-hand side of this slide, there is a scatter plot. It shows the data from individual countries. As what we can see from the data, the prevalence of need increases, including the spectacles, increases in the country where the human development index are higher. If we exclude spectacles, what we see from the data is that the prevalence of need are more or less the same across all the surveyed countries, despite the human development status. However, when we are looking at how much of those needs have already been met or the access to assistive technology, we see a very clear and a strong trend or this association that we see the access rate or the met need are increasing in those countries with high human development index. And this access has a huge variation. the inequality in the access across countries are huge, where in some developed countries, the access is nearly 90%, and in the other countries, this can be as low as below 3%. And when the survey asked people where they got their assistive product and who paid for the product and the services, what we found out from the survey, and it is reflected in the two-box plot, which is showing on this slide, most of the users got their assistive product and also the services from private shops or clinics, and they paid for their product and services out of pocket. And when we ask people what are the reasons for them not to have the product that they need, here is the response as shown in this slide in the two-box plot. The cost, no support, the high cost, no support to get the product, or there's simply no product available in the country or in the place where they live. Those are the key barriers reported by the people of not having the product they need. So those are the findings from the population, and the WHO continued to seek more evidence. We reached out to all the member states to understand what the country's assistive technology system looks like. And we received 70 responses from 70 member states by the end of 2021. Here in this slide, it shows a spider plot with 10 arms pointing at 10 key elements in the assistive technology system in the country. And the purple and the orange net overlay shows the key element and the findings with the coverage. And here, what we found out is that there's a significant shortfall in the workforce and also the services in place, despite the existence of the legislation, funding, or measurement to cover users' cost. The system is not fully functioning because of a lack of services and the well-trained workforce. So based on these findings, WHO and UNICEF outlined 10 recommendations for the whole sector to move forward. And here is the summary. To improve access to assistive technology, all sectors need to work together. And we need to continue investing in data, evidence, research, and innovation to bring the assistive technology and the needed services to the people who need them. So to conclude my presentation, I want to thank all the contributors to this report, and I encourage everyone to download the copy of the report and also to read more evidence presented in this global collaborative effort. And thank you for your attention.
Thank you so much, Wei. That was a really, really good presentation. And I think there's one complaint that we hear everyone saying there's lack of very good data, very good research projects that really show what's going on across the continent. And especially if you come from the global south, we know there's an absence of data. So we do appreciate the information that you're showing us today. And thank you for highlighting high cost. Assistive technology, we have to make sure that assistive technologies are affordable for continents like Africa, Asia to be able to afford to use the devices or the solutions that we come up with. There's also lack of support, and this is really, really critical because that's where also expertise comes into play, that you do not want to have an assistive technology and when something happens, when you can't use it and it needs to be fixed, there's nobody to support you. So there's definitely a need to develop capacity in that space. And then just lack of availability of simple solutions, simple assistive technology solutions. And for me, when I look at this situation, at the findings that you presented, it just creates an opportunity because we said very clearly, 2.5 billion people need assistive technology, and only 1 in 10 have access. So there's definitely a growing market and a need for expertise support in this space. So thank you so much. I know she has to leave in a few minutes for another session. Is there anyone who has a question for Wei about the report? Yes, please.
Thank you so much. I didn't know that. I'm sorry I was late, but I read the report before. And my question is that availability for assistive technology for very basic needs is lacking in many areas, Africa and Asia, and I'm pointing out the countries that they have been affected by sanction as well. So not only that the government doesn't support them, I'm talking especially about a country like Iran. I'm from Iran. And we cannot get, of course, any support by government. We have many barriers by government to stop us. And on addition, we cannot get any grant. So I started an Iranian-Swedish company, and is totally just non-profitable. We are a group of mechanical engineers. We just went to build for the basic things as grab bars that they didn't exist. So thankfully it grew and grew, but we constantly are facing the barriers, sanctions. For example, one of the small ones that I used to buy plastic PVC from China, and then the company said they cannot sell to us because of the sanctions. So we had to register a company in Turkey and buy it. My question is that nobody talks about the countries that they have been affected by sanctions, because they are both beaten by their government and they don't have any access to international funds, and they're really struggling. I don't know if there is any answer to that.
Thank you very much for the question. I think that's a very important aspect that we should consider. In assistive technology system, we should consider all the population affected, and the development or improving access should not marginalize any specific population. And the conversation should happen across the sector, and this should be a global effort. So thank you very much for pointing that out, and we definitely would like to encourage more political dialogue and engage all the sectors in this work of improving access. Thank you.
Thank you so much for your question. Any other question? All right. So thank you so much for the report. And you have an opportunity to download the report from the WHO website. So thank you. Yes, so we will move forward, and I believe we are meeting someone from Kenya who's going to be discussing a career portal for persons with disabilities. This is in partnership with Safaricom. So I don't know who we have online.
Good morning.
Morning.
Thank you so much. My name is Faith Masengo. I am from EnableMe, Kenya, and I am really honored to be presenting today at the Zero Project Award conference all the way from Kenya. So it's very sunny here, and I am a chocolate African woman with braids, black braids, and I'm wearing a traditional head wrap, and I am wearing a cover up with leopard prints. So I just want to talk about EnableMe. So EnableMe is an online platform for persons with disabilities, and we are in so far 6 countries. And today I'll be talking specifically about the EnableMe Kenya community. So maybe if we can show the slides, can go to the first slide. Yeah, so thank you so much. So let's move on to the second slide. Yeah, so I'm showing a picture of our community. You can see during one of the events, we were, we organized community-based events. So we were holding a mental health talk, and we were discussing everything to do with mental health. So far we have 200 articles on the platform, and we have been able to register 350 persons with disabilities in Kenya. The beauty is that we've been able to do this through social media and planning online events. So currently we've been able to plan over 10 online events, and that's how we've been able to create publicity for our website. And we talk about all types of disabilities on the website, and we also answer questions in the community. I want to explain it as a platform where social connection between persons with disabilities happen, and because they lack the support, the community and the platform has been the solution to bringing people who are experiencing the same life situations together so that they can help each other and answer questions from each other. My most memorable moment actually was when we received an email from a mother in Sierra County, and she told us that she was glad that such a platform exists because she's been a parent to a child with a disability with no information. And I want to just highlight that in Kenya, just 18% of persons with disabilities get to have quality education. So you can imagine that our website is catering to the 10% of persons living with disabilities here in Kenya, and giving information that they would have not been able to get. The cost of healthcare in Kenya is also very high, and our articles and our expert contributions from the website help persons with disabilities in Kenya to actually learn about the conditions that they have, and they get to ask questions. The beauty is that we have experts who also answer questions in the community. So you can look at it as a platform where amazing conversations and helpful conversations happen. And we have the information portal where we have a lot of information for persons with disabilities. So our impact so far is that we've been able to reach over 200,000 people since we started the website in 2021. And we've posted over 100 jobs on the portal as well. And I have community members like Brian who've gotten jobs just off of like reading our website and seeing the job postings that we post there. And I'm happy because our website is helping to change the narrative from the charity model of looking at persons with disabilities as needy, but also showing that persons with disabilities can work, and leading the way in giving information to employers on how they can incorporate persons with disabilities in their hiring processes. And as a woman who also has struggled with my own personal health conditions, I can say for sure that I have learned quite a lot from the platform about health and about mental health. I want to highlight one of our articles, which has 25,000 views and 1 year ago posted, and it's about the suicide helplines that you can call in Kenya if you want to speak to someone urgently. So I'm really proud of the work that we've been doing, and I'm happy that this is information that is so scarce here in Kenya. And we are providing a one-stop solution so that persons with disabilities can be able to get the information they require. And our next steps, of course, is we are looking to be sustainable long-term. And because of that, we are now positioning ourselves as a technical partner to organizations of persons with disabilities and health conditions to support them in doing the work that we do. Also, the other thing is that we are going to be launching a directory of services for persons with disabilities. And we are going to be listing centers and organizations that are in this sector so that people can be able to know that this information is out there for them. I think I have touched on the most important parts of it, and I will go back to you, Irene.
Thank you so much, Faith, for sharing the information. I think one aspect that you brought into play is the importance of social inclusion, of bringing parents together to understand the types of disabilities their children have, the experiences they are having, and what solutions are out there. I think you also talked about access to information. Education is so critical because education is power. If we do not know how to handle some disabilities, we won't even know how to treat our children or what the solutions are. And I think you also touched on the importance of experts in the community to support the communities in the experiences they're having, including the suicide line that Kenyans are able to call to at least speak to someone when they're in time of need. All this really adds up to who we are on a daily basis. So thank you so much for sharing this and for showing the importance of independence, because bottom line is we're trying to create an independent community. So next, please stay on. I'm sure someone will have a question for you. So I think we'll move on to Malaysia and learn about a new program in Malaysia. Go ahead, please.
Thank you, Irene. A very good morning to all of you, and pleased to be here. We were here in 2010 at the Zero Project, and at that time we were sharing about, Malaysia was sharing about the Return to Work program, a program in which we assist beneficiaries under our social security compensation, where we shared a lot about the humane or the manual services that we have used or deployed in order to assist beneficiaries with disabilities to return or to reintegrate them to employment. And today, following a lot of things that has happened in the past few years, I'm here to share with you how we have scaled up our services with Assistive Technologies to IT, which is My Future Jobs, which is the national employment platform that's used in Malaysia right now. So just a little bit about where we're coming from, where I come from. I come from the Social Security Organization of Malaysia, in which we look at the social protection for employees who are working. So they are really people who are already at work. And here we have employment benefit and so on. But the thing that I would like to focus here is on the employment insurance system, in which we have provisions in the Act to assist retrenched workers, persons with disabilities, as well as loss of employment, where we provide compensation, but we also look into providing employment services to them from the time that they are unemployed, or if a person with disability from the time they've acquired an injury and so on, the process in which we reintegrate them back to work. And in 2019, we have scaled up, in which there's a cabinet decision for us in the agency, an agency under the Ministry of Human Resources, in which we are now looking at the whole spectrum of job seekers, from persons with disabilities right up to those who with acquired or even congenital, so on, and any job seekers really. But the focus of today's presentations will be more on the interventions that we have for persons with disabilities through this employment services portal that I would like to showcase. So My Future Jobs is a national employment platform, like I mentioned, focusing to the interventions for persons with disabilities. There are three components that make up this whole solution. Yeah. Number one is the portal itself. If you see the middle, the job brokerage, in which the solution uses artificial intelligence. We use a range of taxonomy that's based on the European standards, which is of course contextualized to the Malaysian occupational standards as well. And we use a lot of machine learning in terms of improving the matching in the recommendations of what are the type of jobs that should be matched based on the profiles that have been put. This is a free platform for all employers, all job seekers, and it's really skewed to one personal ID or the national ID, so we can really track them from the time that they are in the system right up to the time they are employed, and if they have lost of employed again. So that's one part of that portal that I'll be zooming into shortly. But the portal also includes the case management aspect, which we quite often hear it being done manually, but this has been integrated together with the employment services portal, where we have the profiling, we do a lot of the career counselings, upskilling recommendations, monitorings that can be done through the portal itself, which I would give you some screenshots and examples of how we do this through the national employment portal, which is My Future Jobs. And the third component is very, very important, because whatever data that we collect through the portals, be it from the employers putting in vacancies, all the job seekers profiles in which we get them integrated from several agencies, for example, the Youth Ministry and so on. So this data is real-time data in which allows us to churn a lot of information on what are the skill sets that we have in the portal, what are the requirements of the employers in terms of the skill sets, the competencies that are required in terms of matching and so on, which these data is provided to various ministries, debated in the parliament as well, for us, for them to make more informed decisions in terms of policy making. So these three components are integrated in one single platform. So what do we have in My Future Jobs? We have a lot of this data analytics, matching algorithms and taxonomies that we have, in which we use to track portals. So for every single data field, if I can share with you, we have a taxonomy in which allows us to set matching affinities. Okay, if I can give an example of a type of disability, which is one of the matching algorithms in the portal, how would one type of disability would match or recommend jobs that would be suitable to a specific kind of disability, I mean, based on the categories of disabilities that we have in Malaysia. So every single taxonomy, data field, this matching affinities is set by the organization itself, so we're able to identify based on target groups what are the matching affinities, what are the thresholds that we can set, and this does not require intervention of a vendor, but we use validation. We work together with various ministries, industries, target groups for us to, based on the default values that have been set, what would be the thresholds or the matching affinities that is agreed based on the agencies, and that is used to set whatever matching percentages that we have in the system that will generate outcomes. And from this, whatever that has been set in terms of matching algorithms, thresholds, or the percentages, we will use this to evaluate how efficient or how, in terms of the outcomes, has employment happened or has it not happened, and so on. So we're able to evaluate the efficiency and then from time to time improve the matching algorithms that's been set, all right? So just an example, it's a set of components which the portal is very much based on skills and competencies. This is very important because, as we all know, it's very hard for us to go out there and sell in terms of wanting to match a candidate with a specific disability to employment opportunities out there. But when we have a portal that's very much skills and competencies based, that gives us an upper hand for us to convince employers to say that, look, these are the skills and competencies that can be done by the specific individual, and why not hire that individual with specific assistive devices that we have in the market that can support them back to employment. So it gives us the strength and empowerment to actually convince employers to hire this group of individuals, because we have set the matching, in terms of the occupation standards based on the competencies and skills that an individual would have. And if you can see the circle on the right, there are a few in terms of the matching components, the parameters that we have set. And if you can see, that I've marked a box there which indicates disability is in fact one of the matching affinities that we set in the portal. Apart from what has in the portal itself, in terms of the portal does the automatic matching where job seekers get their matches. At the same time, we understand that, you know, a portal is not always the solution. We need some form of humane services that will support the interventions through the portal as well. So we have case management that we also do it digitally through the system, the same platform, in which a caseworker will be able to assist an individual who's referred to us for employment services. We monitor the interventions, and every single behavior of the job seeker is tracked. For example, how often a person with disabilities who's been referred for the program actually logs into the portal if they can, and look for employment opportunities as suitable to them, and for the caseworker to communicate with the employers and do the necessary interventions, setting up interviews and so on. If a job seeker with disability is not able to access the system, they have limitations in terms of accessing, the caseworker are able to apply on behalf of the job seekers and help them out until they are able to get the employment opportunity, including setting interventions and so on. And every single activities, even from the employer, the caseworker, and the job seeker, is tracked through this digital support. And we also have training recommendations that are provided through the portal as well. So based on skills and competency gap that is available through the whatever match that has happened, we're able to recommend training programs through the portal itself on what are the specific training programs that can assist them in terms of upskilling and reskilling in order for them to get the employment. To scale up further, we know that in Malaysia we have 54 branches of Social Security, a little bit more, I'm coming there, and we not only operate through our 54 branches and through the portal as well, we have set up satellite centers and educated the satellite coordinators to help them on how to use the portal so that anyone who's close by can actually walk up and use the portal at any time for free. And this is also available in vocational centers for persons with disabilities, so we assist them through this support as well. We've assisted 4,400, an update from the data that we have shared, because we've had many various, apart from the portal itself, we've got a lot of incentives, financial incentives, to encourage or stimulate employers to provide employment opportunities through My Future Jobs, in which they're incentivized through tax incentives and hiring incentives as well. Last but not least, a few things for the portal to be scaled up further, for it to be more efficient, a lot of work to be done in terms of letting it being data-driven. Machine learning is solely based on, so the more data that we have, the better it becomes, and we're working on legislative frameworks as well to mandate anyone who's 16 years and above to come into the portal, for us to make sure that we have the skills and the competencies input, and for us to understand what are the demands that we have. So this is pretty much, I mean, in terms of the way forward, you can read the points that I've listed out, but thank you very much once again in allowing us to share our platform for today. Thank you very much.
Thank you so much for sharing the information. Let me say first, congratulations, very impressive. 53,000 jobs for persons with disabilities since 2017. That's amazing. So congratulations. But one thing that stood out is how you're taking care of the entire ecosystem. There's the jobs, of course, employment, but you're also matching the people who are seeking jobs with proper jobs, and you're also looking at their needs and trying to figure out, how do we talk to employers? How do we assign caseworkers? How do we also support the employees, the people who are the potential employees? So I think, and the additional training that you're providing to support the full ecosystem. So I think that's one message that you're sending across, that as we do some of these projects, let's think about the full ecosystem, because you can take one piece, but you will not succeed if the other pieces of the puzzle are missing. So thank you so much for sharing that information. And maybe I'll stop briefly, because the project from Kenya, Faith, and the project from Malaysia, they're both on employment, and maybe I want to see if there's someone who has a question for the two of them, please. Any questions on employment for our speakers? All right. So I think now we will proceed to India, and we will learn about a pediatrics assistive technology project.
Thank you, Irene. So my name is Marie BRIEN, and I'm very pleased to be presenting today on Amar Sangam's innovations in assistive technology, or pediatric assistive technology provision program. So a bit of background about our organization and our project. Amar Seva Sangam, or ASA, is an NGO started in 1981 in South Tamil Nadu, in rural South, providing services to children and adults with disabilities. So ASA's Enabling Inclusion program began in 2014 and provides early intervention and rehab services for children with disabilities. So in October 2020, we launched a pediatric AT provision program that was needed to provide pediatric assistive products by responding to local barriers to AT access with specific solutions. So how does our project blend in with the Zero Project 2023 themes? Well, we contribute to independent living by enabling right-based AT access and equal opportunities at all ages, pediatric and adults. Our pediatric AT provision maximizes child development and functional independence from an early age. We also enable accessibility and inclusion, access to education, children's participation in school with their peers. We maximize involvement in community life. And I will demonstrate our proven impact, innovation, and scalability. And you see below some of the children on the picture who have benefited from our AT provision program. So what are the innovative aspects of our pediatric AT provision program? Well, we identify local AT barriers and facilitators using an organizational and regional level survey that we have developed. That survey is based on the WHO's Priority Assistive Product List, or APL, and also based on the principles of AT access, so the 5 A's and Q's, which I will describe later. We respond to local barriers to AT access in low-resource, rural India with specific solutions that have been identified by the stakeholders. So it catalyzes AT access by supporting various stakeholder groups. So it supports children with disabilities with outreach AT service provision. We support families by facilitating local AT camps, as well as co-funding for the assistive products. We support the rural rehab specialists with capacity building, a comprehensive AT service provision framework, as well as the procurement process. And we support local AT suppliers with training and expertise. So let's talk about the essence of our program. Well, as I described earlier, it's based on locally identified barriers and facilitators according to the WHO's principles of AT access. And our survey questions are based on accessibility, adaptability, acceptability, affordability, availability, and quality. And all this is at a local, regional level. So what we have done is develop capacity building programs for the rehab service providers on assessment, prescription, order, fit, adaptation, training, and use of APs. We've implemented a decentralized network of AT assessment camps in rural South Tamil Nadu, and our AP service provision as well in that area. We've identified local suppliers for provision, adaptation, and repair of APs. We've developed a shared cost structure according to a detailed socioeconomic assessment. We've developed AT fundraising campaign through Handicapées International based in Toronto, Canada. We have community awareness programs in villages, in all the different districts, and parent groups to address the AP-related stigma. And lastly, we provide educational programs for service users and families. So all of this program was developed in response to our survey that we launched in 2020. So looking at our impact created since 2020, we've trained 102 rehab workers on AP assessment, prescription, order, fit, adaptation, training, and follow-up. We also trained 2 therapists as AT coordinators to guide, monitor, and evaluate the practice. We've had 30 outreach AT camps held since 2020 in the 3 southern districts of Tamil Nadu. And we distributed a total of 11 APs to children with disabilities. We've developed an AT guidebook for the local rehab workers. And we've further developed our parent groups and community awareness groups in the districts. So the picture depicts an adolescent receiving his power chair and being independent in his village for the first time, and also a little girl using her rollator walker to get to Anganwadi preschool from her home. So here you have the total amounts of AP distributed, 53 hearing aids and accessories, 18 powered and manual wheelchairs, 72 mobility devices, 188 postural devices, including CP chairs, corner chairs, standing frames, 585 adaptations or environmental adaptations to the homes, and 989 orthotics. So the total's 1,711 since 2020. So a functional independence and participation story. Satya Murthy, 12-year-old boy with spastic cerebral palsy involving mainly his lower extremities. He's able to ambulate with a rollator walker for short distances, but with much effort and energy expenditure due to severe tightness in his legs. He just received a new manual wheelchair, which he propels efficiently for long distances with great speed. He's able to follow his peers, participate in inclusive school, and participate in community activities. So looking at financing, sustainability, and our challenges, as I mentioned, we function with a co-payment model by family based on our socioeconomic assessment through Handicapées International, our sister organization in Toronto. And we have various sources of funding, national, international donors, and some from government. And we plan on expanding our AT program through the Enabling Inclusion program at Amar Sangam, which has already scaled up to 9 licensed partner NGOs in India, as well as globally now in Ethiopia. And we will also scale our AT program through the state of Tamil Nadu, where we have partnerships as well. Challenges are creating enabling environments. Physical and social barriers, stigma continue to exist, and that's an ongoing, it's work in progress, as well as team coordination for all the members of the AT provision because of the distant areas needed to contact and deliver equipment. So our next steps are the implementation of our pediatric AT provision module, a module which has been developed to be included in our Enabling Inclusion app. So it's a step-by-step roadmap to AT service provision for each child receiving service. So that will guide the rehab workers to every step of AT access. We plan to scale our model to other organizations and NGOs, which we collaborate with, and we will expand the range, quality, and availability of pediatric mobility aids for a cost-effective supply. And lastly, we will continue to train local and regional vendors for supply, distribution, and servicing of custom postural support devices using sustainable materials. So I thank you very much for your attention.
So thank you so much for sharing that information with us. What's interesting is how you follow the WHO principles. And I'm just wondering, just as a question, is how do you balance accessibility, adaptability, acceptability, availability, and quality? Because it's not easy for most innovations that we've seen. It's either you have a really good innovation, but it's too expensive, or it's not available. So can you talk briefly about that?
I think for each of those A's and Q's, I think you have to have an acceptable level. Another A, but I think, for example, for quality, it has to be an acceptable level of quality where it is safe equipment, it is functional for the child or the person with disabilities. So it has to be of an acceptable quality that the user can functionally use safely. And I think for the affordability, again, it has to be an acceptable, I still return to everything has to be at an acceptable level, that you're reaching that happy medium, that's why we have developed that co-payment on a sliding scale where we look at family socioeconomic levels and contribute some funds to that. If we look at accessibility, again, accessibility, it's always work in progress, and the acceptability is also, that's work in progress for creating enabling environment. So it's a multi-prong approach, so that's why we gathered stakeholder feedback starting in 2020, before the global AT report came out, and really acted upon, had an action plan based on every point of that stakeholder feedback. So I think it just has to be an acceptable level, and where is that acceptable level? That can be subjective. I say as long as you're enabling function for a child and not waiting till they are adolescent or adults to provide the needed equipment, that's really, as a pediatric physiotherapist for 40 years, that is what is in my heart, and that's what we've developed as a program. Yeah, thank you for your question.
No, thank you so much. I think before we go to our last three innovations, is there a question for Marie about the work they're doing in India? Yes, please. Let's keep the questions to maximum 1 minute, please. Thank you.
May I ask that what was the percentage of the product that it was built in India and how much it was imported? Because the cost of the product that you want to import, of course, it doesn't match the, you know, the affordability of the people in that country.
We are not importing products. We are using, some are custom made locally. If it's a walking aid or wheelchairs, they are locally available. So there's no importation being done. And now we have to really look at the quality cost ratio. So we don't want to go so low in price that you're compromising quality. So it's a fine balance. And if the price is too high, it cannot be obtained. So it's really, we're still looking at suppliers to try to get that best ratio that's acceptable. Yeah.
Okay.
All right, thank you so much. One more question, yes, please.
Thank you. I would be interested how you monitor the outcomes of your AT provision.
Yeah. Besides our numbers are only part of the
yes,
story.
The quality outcomes. Do you follow the care process, or do you follow it up, care process?
It's a constant reevaluation. I have just spent 6 weeks at Amar, Seva, Sangam, exactly that, to be looking at not just the numbers of the impact in terms of numbers, but looking at how the equipment is being used by the children and families in their home. So we want to make sure, and that's why we've developed an AT provision module, which will be in our Enabling Inclusion app, that will guide all of the elements of the training and the follow-up and how the equipment is fitting and does it need adaptations. So we have a multitude of sequential questions, step-by-step approach that we really want to ensure that the fit is good, that it is being used within their environment. So it's really a step-by-step approach. So there has to be follow-up by the local therapists or community rehab workers on how it is fitting, how it is being used. And then we also have AT coordinators, 2 AT coordinators on the ground that are monitoring the quality and so on. So it's a team approach. We have community rehab workers, we have physiotherapists and speech therapists, and we also have, you have different people working remotely from Canada. So it's been a big project, but very successful, and it's work in progress. We're constantly trying to upgrade and relook at, are we providing the best AT that meets the needs of each child? So.
Thank you. So we will go over to Kenya now, and we will learn more about GDI Hub and Innovate Now and the work that they're doing in Africa. Over to you, Bernard.
All right, good morning. Those are not my slides. Yes, so as we wait for the right slides, my name is Bernard CHIIRA. I'm the director of Innovate Now, which is Africa's first assistive technology accelerator. And we approach this from an innovation perspective. I think from the report that was read before here by the WHO, one of the recommendations was that we need to invest in research and innovation, and this is part of what we've been focusing on. So the right slides are now on, so let's see whether I know how to move them. Yes, I know how to move them. Yeah, I just want to begin by just sharing a little bit of what we've been able to achieve, because we've been building an inclusive innovation ecosystem, and what that means is, who are the stakeholders for innovation? How do you bring them together? And how do you make the innovation actually happen? So before Innovate Now was launched in 2019 in Kenya, accelerator programs and incubation programs had existed in Africa for many, many years in other sectors. Kenya particularly is a leader in innovation in many areas, and we are famous for mobile money. I think we are one of the countries in the world where we do most of our financial business on the mobile phone. And this was a problem which was solved because 90% of the population was unbanked. And what that means simply is that banks refused to give them bank accounts. But technology helped with that. So we have trained more than 100 individuals who are founders or part of a group that is developing an assistive technology solution. And these have come from 11 nationalities across Africa, the UK and the US. And we have 45 startups in our portfolio. And we've delivered over 600 hours of mentoring because we are a mentor-driven program. But let's look at some context here about what we do. Creating market fit and scalable and investable assistive technology solutions is really the space that we are focusing on. And this work is founded by Global Disability Innovation Hub. And my colleague Kathy is here, and Ben, I don't know whether he's in the room. And this came out of a project called the 80-20-30 project. That was the first global initiative coming from the UK to the world in partnership to try and bridge the gap for access to assistive technology. And part of this project was to test what works to drive innovation in emerging markets. And that is how Innovate Now was kind of founded. So GDI Hub is a research and academic center driving disability innovation for a fairer world, based in UCL, University College London, but working with partners across 41 countries. And through these partnerships, we've reached 28 million people in 6 years. So I mentioned that Innovate Now was really a vision. And the question we were asking is there room for innovation in this field? You know, can we have local solutions? Because one of the participants here mentioned about things like sanctions and how they can affect international trade or getting materials or goods from outside. So this is really, in a big way, the biggest barrier we have for assistive technology in developing countries. Especially in Kenya, we import close to 100%. So there is need for local industry. But where does local industry come from? Now, you have to look at it from a market perspective if you want to create local industry. And you have to look at the problem as an opportunity. You know, if it's a product problem, who makes the product? If it's a distribution problem, who can distribute. And this is the kind of thinking we're trying to bring. But we're also trying to say it's about innovation, so it's about creating new business models. Now, some context here about what are the leading challenges in this area. So inadequate access to assistive technology sits high in that list, but we also have lack of accessibility for the built environment and also the digital space, and lack of education opportunities and work opportunities as well for persons with disabilities. And I think some of the solutions shared here are addressing some of this. And of course, the policy framework is always playing catch up. So we zeroed in on how might we address this innovation for assistive technology. And how I want to share this is giving examples of some of the locally relevant solutions that have been supported through our accelerator. So I'll give 3 examples, but I just want to mention here that we are currently with a portfolio of 45 and growing. So I'll get right into it, and maybe before I do that, share a little bit about something we truly believe in, and that's the importance of co-design and disability representation. So one of our approaches to how we develop innovation is that we create proximity for innovators and entrepreneurs to collaborate with the need knowers or the persons with disabilities in their settings, in their communities. So part of our program includes at least 6 weeks where entrepreneurs just spend time with their target users to understand their daily lives and the context, and to start framing the problem they want to solve informed by this. Ooh, I have 1 minute left, oh my God. Okay. So let's look at these examples. Now, we talked of local manufacturing. Lincell Technologies is a startup that came in our first cohort, and what they do is they manufacture power wheelchair or tricycles locally. And they began this by recycling. The innovator, Lincoln, was inspired to recycle and also to create mobility, electric mobility, because these were more sustainable approaches and also can take care of the environment. This is the tricycle that I'm showing now on the screen. It's basically made of retrofitted parts. Office chair, you can see some of the wheels are bicycle wheels. And the most important thing about this is that the battery itself, which is a lithium-ion battery, was initially developed by recycling laptop batteries and recalibrating them to deliver the range and the power that's required. Then one of the solutions that's going to be awarded here is Assist All, and this was a solution that was developed to help with justice, with electoral process, but also the day-to-day living of deaf and hard of hearing, to get sign language on demand on the mobile phone. And the way this is developed is really a platform-based business model, where on one side you develop the ecosystem of sign language interpreters, and then on the other side you develop accessible application that people who need this service can call sign language on demand, just the way you'd call an Uber. And I'll try to rush now because I'm already out of time. 10 seconds. I'm going to go to the last slide because how can we make this happen across Africa? Now, the recommendation by WHO is invest in assistive technology innovation. So we are inviting foundations that may want to learn from our innovation model and support our work to collaborate with us to drive this across Africa. You can partner. We run cycles of innovation where this training is provided in a cohort-based fashion. And you can also offer expertise. We're actually now setting up a venture fund linked to the accelerator. So, and this is to help with the early stage of innovation where funding is missing. And this is the only way that these solutions will get to market.
Thank you, Bernard.
And this is it. We can do more together. Thank you.
Trust me, we definitely want to hear more from Bernard, and I hope he can do that during his closing remarks. I want to make sure that we have a chance to give at least Zambia and Djibouti a chance to present. So we'll go over to Djibouti. Thank you.
Thank you, Irene. And may I have the slides? Thank you. So my name is Idill Abdourahman, and I'm the project manager at a National Agency for Persons with Disabilities in Djibouti. And with me are my director and the developer behind the system. So firstly, we would like to express our gratitude for being one of the awardees of the Zero Project 2023. And we would like to thank especially the SO Foundation for organizing such a lovely global event. So let's dive into the presentation. Under the strong support and direction of the President of the Republic of Djibouti, Ismail Omar, the main instigator of the dematerialization of the administration in Djibouti, the General Director of the National Agency for Persons with Disabilities, in line with the modernized strategy, has launched two main projects. These are the management of the system of the National Agency for Persons with Disabilities and the integrated system of the management of persons with disabilities. Okay, so we'll go through the difficulties encountered before creating this system. So prior to the implementation of this disability management system at the National Agency for Persons with Disabilities, employees faced many challenges in managing disability, records, and efficiently in compliance with legal obligations. So manual processes and for collecting data, storing, analyzing were very inefficient, leading to delays in meeting needs of persons with disabilities and wasted employee time. In addition, transcription, errors, and duplication of data were frequent, which compromised the quality and accuracy of the information contained in these files. This problem statement highlights the challenges faced by employees in managing disability cases without any effective management system and demonstrates the need for a solution to improve disability management process at the agency. So let's talk about the SIG-IMPH, which is the integrated management of disability cases. So SIG-IMPH consists of automating all the internal management processes at the agency using a modern management software package which integrated the main functional components of the IMPH. So let me just correct myself. This is the integrated system of the agency itself. So all the processes that happens in the agency is managed through this, whether these are projects being implemented or managed or elaborated, whether it's invoices, whether it's an employee records and contracts, everything is stored in the system, even our presence. So signing in for work is happening there. Okay. So go over to the integrated disability management system, which is the system for managing the files of persons with disabilities. The SIG-IMPH is the biometric management of disabled people and the monitoring of their services. SIG-IMPH allows, firstly, the biometric enrollment of people with disabilities, and secondly, the registration of their various and varied needs, whether these are social, educational, or assistive technology, for that matter, with a view to offering them appropriate care and support. In other words, this innovative solution was developed with the aim of better identifying people with disabilities and processing their requests more efficiently and quickly. So this system identifies the person's situation, the typology of the disability, and the monitoring progress of their file. of the service that they have requested. So it tells us whether it's in progress, whether it's completed. So there is an interface between the two systems. Okay, sorry. So there is an interface between the two systems. The integrated management system of the National Agency for Persons with Disabilities is connected to the integrated management system for persons with disabilities through an API. This means that the two systems can securely exchange data using API as an interconnection platform. When a disabled person makes a request from the integrated management system for people with disabilities, this information is transmitted to the integrated management system of the National Agency for Persons with Disabilities from the existing data stored in the system. So this is linked to our stock management in inventory. So once someone requests a assistive material through the system, this will be pulled out from the other system where we store our inventory. So in summary, the API allows the two systems to interface and share data in a secure manner, provide an efficient solution for managing requests for people with disabilities. So the interfacing is with X-Road in the enrollment procedures of the counters of the National Agency for Persons with Disabilities. It is not impossible to the identity of a person to take advantage of all types of coverage of the IMPH offers people with disabilities. Keeping this in mind, we are part of the integrated ecosystem of the National Interoperability Platform managed by the National Agency for State Information Systems in Djibouti. So to speak, as a member of the ecosystem, we can benefit from the direct access to the National Registry of the Natural Persons managed by the General Directorate of Population and Family to identify at the source the exact identity of the individual. And this is to avoid any legal violations. Thanks to the API, we can now enroll citizens without worrying of any violations. So before that, we had many people that will come into the agency and identify themselves as a certain person, but this was not the case. Because the problem with people with disabilities in Djibouti is that many of their identities are sold to other people. And this is a national problem that we are having. And this system has solved this issue for persons with disabilities. So our job is not quite done yet. We have a lot of other web applications to develop. So I will just go through each one really quickly. So setting up a mobile application of the biometric system. And this is for people with disabilities to download the app on their phones and follow up on their cases and the progress of their request, whether they are waiting to get employed, whether they are waiting to be referred to a medical service, whether they're waiting for, if they are job seekers or training or anything that is required or assistive material. This is the system. Through this system, we have distributed more than 4,000 assistive material, mostly being mobility assistive material. And then we have the enlargement of the integrated system for disability management of the IMPH. So we have opened branches in each region of Djibouti. There are 5 external regions, and then we have Djiboutiville as well. Each of them have a branch today, and our idea is that we must put this system in their offices as well, so that we can get a larger data collected. And then we had the digitization of the Djibouti Sign Language Dictionary. This will be offered also through this system, and this is through the system by being identified. So what the system does is, once you have enrolled the person, you will also distribute a card, a disability card. So only if a person is enrolled, are they allowed to receive a disability card. This disability of other public services. And then there's also an e-learning platform that we want to develop.
10 seconds, please.
Yes. And then the last one is a call center of management of grievances, because we have a free disability line, a hotline, which is 1917, and that is also linked to our system. Once they call in that system, it pops up on this system where we can manage all persons calling in and also physically attending the agency. Thank you very much. Over to you, Irene.
Thank you so much. It's always exciting to hear some disability innovation, especially in government. As we all know, in African governments, we still have a long way to go in the disability space. So when the government takes the initiative, it's very, very commendable because others are bound to follow. In this case, especially the registration of persons with disabilities. In Africa, we have a data issue. I don't think there's a single country that clearly knows how many people with disabilities are citizens of their country. So when you have such a system, I know in Kenya we do have the registration of persons with disabilities, and it's great because it comes with its benefits. So a good example, I do employ persons with disabilities, and recently we had a situation where when people got their first paychecks and they got taxed, it was very painful, but it's because they were not registered. So that inspired them to find time to go and get themselves registered as persons with disabilities so that they can start getting the benefits like just being tax exempt, which is very, very important to them. But I do believe there's a need for awareness building for persons with disabilities to be able to register with their governments so that they can be able to get benefits and access to assistive technology or any other support that they need. So thank you so much. Sorry, go ahead.
Let me just add one thing to it. We actually have a national prevalence survey done. So we have 85,000 people with disabilities in Djibouti, 69% of those being mobility-reduced people. So we do have quite a strong data, and this was done using the Washington Group survey.
Fantastic, fantastic. Thank you for the clarification. Yeah, so we'll go over to Zambia, and as I introduce the person sitting next to me, he was a recipient of the Inclusive Africa Innovation Award. Inclusive Africa Conference is the largest disability and accessibility assistive technology conference in Africa. So if you want to learn about what's going on in Africa in disability, in accessibility, in assistive technology, we invite you to join us May 29th through the 31st in Nairobi, Kenya. And what we do, we try to highlight the innovations that are going on across the continent. We highlight research projects so that we can all learn what's going on. And the person sitting right next to me was a recipient for the 2022 innovation. So I want to give him a few minutes to share about what his innovation is all about, what inspired him to start it, and we can move from there. Thank you so much, Bright. Welcome.
Thank you so much. As has been stated, my name is Bright MBWALYA, for those who are wondering what the BWA is pronounced as. I am, I don't know if I have my slides here. I'm somebody who's living with epilepsy, and I am from Zambia. Growing up, I did not know anything about epilepsy until 2016, while in university, where I started experiencing seizures. I didn't even know they were called seizures. I just used to hear people tell me, "You fall." There are times when you fall, and that's all I knew until I rushed to the hospital one time, and the doctors equally didn't say much. They just gave me a packet of medication and told me, "Go home, take these." But curious me decided to record myself having a seizure on a computer because I noticed there's a way I used to feel prior to a seizure that I decided to record myself and then start reading more about what was going on. I don't know if my slides are here or not. Okay, if not, I'll just go ahead and talk about the condition. So when I recorded myself having a seizure, I decided to read more about what exactly was going on, and I discovered that what I was experiencing were called simple seizures. And as I read more, I discovered later on that this is not really just something to look at and fiddle around with. I decided to go to the hospital, and later on a doctor told me I was living with epilepsy. I had been diagnosed with epilepsy, and it was not something that I knew about. And so while living with this condition, a lot of seizures would often find me, on campus. And I discovered that I was, being nicknamed, called all sorts of names because of my seizures. And one day, walking to the computer lab, I had a seizure, fell to the floor, and as I recovered, I found people exorcising me. Out, in the name of Jesus, out, you demon. And I'm wondering what's going on. And they're telling me, you just had a demon, manifest. And I'm like, wow, people really don't know what this is. And so walking away from there, I was with a friend, and I asked him, what if I could teach people how to take care of me when I have a seizure? And as usual, people thought I was this crazy guy with weird ideas, and he says that can't work in a way, you're crazy. I'm like, okay, fine, I'll give it a shot. And so I decided to build a mobile application that allows me to call for help in a moment that I'm about to suffer a seizure. So when I get my aura, I just push a button on the phone, and the phone is able to do three things. One, it sends a message to whoever I set as my emergency contact to tell them to say, Bright has just suffered a seizure, and gives them my exact location. Two, it starts playing some sound saying, please help, I'm having a seizure. Please help, I'm having a seizure. So that it gets the attention of the people around me. And the third thing is, while they're seeing this guy fiddle on the ground and they hear this phone making its noise, pick it up, they'll be able to find the instructions on what exactly to do to help me in that moment that I'm having a seizure. And I decided to switch my dissertation while in university and work on this exact thing as my dissertation, and the application was done. And funny enough, I would say, this guy comes back to me and says, you are right. Actually, when you suffered a seizure in the lab, you pushed the button and we knew what to do from your application that you're still working on. And I started developing this more and more, the more I started interacting with people who are living with epilepsy. I went to the hospital one day, looking at people, thinking epilepsy means you're dead, sad and whatnot. I decided to just stand up and start talking to them. Hi, my name is Bright. I'm a poet. I'm an engineer, software engineer. I studied IT. Oh, by the way, I have epilepsy. I'm living with epilepsy. And the guys looked at me like it was strange, because all these were living with epilepsy, but they thought life is done for them. And so I started my advocacy works at the hospital, the largest healthcare institution in Zambia, UTH. I started talking to people there, telling them about what epilepsy is and how one can manage that condition. And also just from that, more features were being added to the application. People can get counseling sessions from the application. People can find information about what epilepsy is, and many other features, which I think we can talk about later on. But I would also like to say, my journey living with epilepsy has been the driving force for me to develop this innovation even further, that other people would be able to see that having a disability does not mean the world is done. You can still pursue certain things. Here I am. This morning, I suffered a seizure. I'm here, seated in front of you and talking. And it's an interesting, motivating factor for me, looking at those who are living with disabilities. I just want them to look at me and be able to say, if Bright can do it, I can do it too. And if Bright can find a solution to something that he's living with, maybe I can also do something. Don't be part of the people waiting for the solution, be part of the solution creators, I say. I came across the Inclusive Africa challenge, and I decided to apply. These were big companies that I had applied. And lo and behold, I was the first, awarded #1. I couldn't believe it. When Irene called me to the stage and said, say something, I was speechless. I couldn't speak. I couldn't believe that my innovation had been chosen. But all these are things that I would want to be able to share with those who are living with disabilities, to say, you can be part of the solution creators, or you can still pursue your dreams that you love and all of that. If I can do it, you can do it too. And through my innovation, I hope to speak to the world, but also create a solution for people living with epilepsy. In Zambia, my advocacy sessions have quite grown. I'm speaking to a number of people now. My online sessions, I normally have them every Friday, where I'm talking to people online, and the physical meetings are also happening. The neuro the neurologists in my country often invite me to their seminars and help me, learn on how best we can shape the innovation. And I forgot to mention, this is not only for people who get auras prior to their seizure. For those who don't get auras, that's the signs that you're about to have a seizure. A smartwatch and a neurodetector is being developed so that for children who are being pulled away from school because parents are afraid that my child goes to school, a seizure will happen, and the teachers won't know what to do. For those, the neurodetector is able to sense that you're about to have a seizure, communicates with the watch, and the watch goes into the panic state. SMS to the parents, the sound to the people around, and displays the instructions on how to take care of the child right on the wrist. So all these are works that I'm currently doing, and the MVP is already built. I have one installed on my phone. We can chat and you can see it. And now we're at a stage where we're developing the neurodetector and the smartwatch so that we can give to everybody, children, those who can't afford a smartphone, and even those who have a smartphone. Those who don't get auras, we can cater to all of them so that people can be taken back to school. They have their right to an education and all of that. So Enable has been really, really helpful. I've also been a part of a cohort with Innovate Now, with Bernard, and all these have really helped me see things from a different perspective and create the innovation to where it is now. Thank you.
I'm sure you all see why Bright and his innovation won the Inclusive Africa Innovation Award. And let me say this, the innovation is still in progress. There's still so much that needs to be done. So our hope is to help him to get the expertise he needs to move the product to the next level, to get the funding he needs, and most importantly, to scale it even across Africa, because this issue is not just unique to Zambia. If you travel across the continent, this product can actually benefit millions and millions of Africans. So I hope you've enjoyed listening to him. And I will go ahead and maybe give a few minutes to the last three presenters. If you have a question for the last three presenters, they get first priority before we get any other questions. So please, if you have a question, let me know. Let's see. Anyone? Yes, please. Barely.
Can you hear me now? Oh, wow. Thank you so much for this interesting presentation. I just know that that is sometimes challenging in the African countries with the internet connection. So I just wondered, how do you work with this challenge, or if it exists to get the internet connection and to get the work done when you're sending the SMS and the smartphone and everything. So how does this work? This is my question.
All right, keeping that in mind, we decided to go with GSM connectivity and are already in chats with organizations that can allow us to send this SMS via GSM and not via internet technology.
Great, thank you. Any other question? For any, you can ask across the board if you have a question. Okay, all right. Thank you so much for joining us today. I want to say thank you to Zero Project, one, for putting Africa on the map, because I've been coming to Zero Project for a long time, and this is one of the largest conferences that actually give me a chance to present, to facilitate, and to be part of the program. And yesterday, I remember during the opening ceremony, we had Egypt and we had Kenya at the opening ceremony, so that's really important to us. So I want to thank Zero Project for supporting. We have a partnership with Inclusive Africa and Enable to make sure that our top three recipients of our awards from Africa always come and do a presentation at Zero Project to at least share the work that they're doing in Africa. I want to thank everyone who's here from Asia and the amazing work that you're doing. And the beauty of Africa and Asia, especially if you think about India or Malaysia and African countries, our economic conditions are very similar. So what you find is some of the solutions that are developed in that part of the world is very easy for them to be adopted in parts of Africa. So I want to say thank you, and just to give anyone, we have 5 minutes. If you have some closing remarks, you could quickly say something. Maybe we can start with Djibouti coming this way.
I would just like to thank everyone for giving Djibouti the opportunity to present its system. It's a system that has been ongoing for 2 years, and it will be continuously developed. And it requires a lot of funding, so this is why we're here, to get the visibility and get the funding as well to continue working on this system. Thanks again.
Yeah, thank you. So for me, I think I would want to say that this conference is an amazing platform for all of us to meet, to learn from each other, but most importantly, to take action. So we have presented here opportunities and stories that you may relate with in terms if you need expertise, if you need to learn from any of us, we are open. And I think speaking on behalf of entrepreneurs that want to solve for disability, and also disabled innovators like Bright and myself, is that innovation is not an option that we have to innovate or not to innovate. It is a necessity because the needs we have need unconventional solutions. And I repeat something I shared in my opening remarks. Because of the size of the need and the short time we have to address it, our efforts from now on need to be exponential, because by 2030, we need to include all persons with disabilities, and all our efforts together can help us do that. But if you're investing, invest exponentially. If you're training, train exponentially. If you're doing advocacy, do it exponentially. Thank you.
Thank you, Bernard.
Yes, I'm very proud of Amar Seva Sangam's pediatric AT provision program, because we have to start from children, not wait till they're adults or adolescents to provide needed AT. And often assistive technology is sometimes not appropriate for children. It may be more designed for adults. And so we really have to find wheelchairs, walking aids, any type of postural supports that fit them well, enable function and independence. And it's by providing the needed AT to children that we will facilitate their inclusion and participation with their peers. So.
Thank you. Once again, I would like to thank the Zero Project for having Malaysia on this program. I think for us, it's really a celebration of progress from, like I mentioned, when we came in 2010 and where we are right now. It's true learnings from all of you who share a lot through conferences like this that's made us being able to scale up on what we do. So to also answer Irene's concern, her doubt on the ecosystem, it's always a long journey, but building the ecosystem, regardless of how difficult it is, it's always a start, and you have to have that whole framework in place and slowly embark on all this and putting it all together. So that's very crucial in making the platform a very important one. Thank you very much.
All right, thank you so much for the opportunity to be here and share what we're working on. I would just like to say that epilepsy is not something that is only in Zambia, only in Africa, but we have over 50 million people living with this condition. And the project that we're working on addresses it holistically, and this is something that has been affirmed even by the International Bureau for Epilepsy. It's amazing that we're standing on, 5 international awards, and we can just say, we need your help to get it out there to, help these people who are living with epilepsy. Even myself here. My first time here, I would just love to have the same testimony she has. They came in 2010. Look at where they are. let me come also next year and say, look at where I am. Thank you so much.
So thank you so much. I'll close by saying that 80 to 90% of those who need assistive technology live in developing countries. So there's a huge market opportunity there. But something that's really important is to note that we have high-tech and low-tech assistive technologies. Something low-tech may not be very meaningful in the global north because it's very basic, but you might go to the global south and find out that it's transforming millions of lives. So we highly encourage investments in both ways, and also to think about costs, to think about accessibility, portability, and all those good principles that some of them come from the WHO. And last but not least, please take a chance to speak to some of our presenters today. You never know what value you can add. And I want to say thank you so much to Zero Project. Thank you so much to each one of you. And I hope at some point we can see you in Nairobi, Kenya at the Inclusive Africa Conference. Thank you.
you.